Hypertension, or high blood pressure, is a chronic medical condition that, when left untreated, damages all of the body's blood vessels. More than 1 in 3 veterans have high blood pressure, making it the most common chronic condition for veterans. As many as 1 in 5 military service members also have high blood pressure. Service members and veterans with multiple combat tours of duty or who witnessed death while on duty are at an increased risk for developing high blood pressure. To cope with stress, service members and veterans sometimes turn to smoking, drinking alcohol, and unhealthy eating. These negative coping habits further increase the risk of having high blood pressure and damaging blood vessels. High blood pressure is referred to as the silent killer because it often causes no symptoms until a very significant medical event occurs. Untreated high blood pressure greatly increases the risk of having a heart attack and stroke. If you have sustained a TBI and have untreated high blood pressure, both will increase your risk of getting dementia. It is never too early to make healthy lifestyle choices a habit. Healthy habits that can prevent or reduce high blood pressure and keep your brain and body healthy include eating healthier foods, reducing your salt intake, maintaining a normal weight, reducing your stress, getting good sleep, and increasing physical activity. Managing your blood pressure starts with getting your blood pressure checked at least once a year, even if you feel fine. Your doctor's office or clinic provider will measure your blood pressure at every visit. If your blood pressure cuff reading is high, your provider will likely measure it several times to see if it is consistently high. Your provider may even ask you to come back in 2 weeks to measure it again. They may even have you measure your blood pressure with a blood pressure cuff at home every day for a week or 2. Or your provider may ask you to wear a blood pressure unit to measure your blood pressure over a 24-hour period. It is important to work with a doctor who can diagnose high blood pressure and identify a treatment plan that is right for you. While healthy lifestyle choices is the best option, you may also need medication to treat your high blood pressure. If you need to take a medication for high blood pressure, then your provider will work with you to find the best ones. There are many effective medications that can treat your high blood pressure, and it is important that you take them as prescribed, even if you are feeling fine. When you start a high blood pressure treatment plan, you may have to see your provider several times to talk about the best ways to stick to healthy lifestyle choices and, if needed, to adjust the medication dose to treat your high blood pressure effectively. It is not unusual to need more than one type of medication, so work closely with your healthcare provider. Despite the risks of heart attack, stroke, and dementia from high blood pressure, only half of adults with high blood pressure consistently follow through with healthy lifestyle changes and take their medications as prescribed to keep it under control. If you are prescribed blood pressure medicine, take it regularly and do not skip days. If you have side effects, do not stop taking the medicine. Instead, talk to your doctor about trying another type of medicine. Developing healthy lifestyle habits and managing your blood pressure is a small investment with a big payoff that includes keeping your brain and body healthy and lowering your risk for stroke and dementia. Thank you for watching. Click the links below this video for more information on high blood pressure.